Hello, I'm Meg Patterson, and today I'll be speaking about the importance of informed consent in the perioperative setting and the role of the nurse in understanding and ensuring that a consent is achieved. It is no secret that communication skills are an essential attribute in nurses who work in the perioperative setting. In his 2013 Perioperative Practice Journal, Mark Osbiston reminds us that there are many different types of communication used between the practitioner or nurse and the patient. Verbal communication, written consent, and the ability to recognise and act upon verbal cues are all skills that must be practiced and understood by the perioperative nurse. Also in this journal edition, Mark Osbiston reminds us that communication between the nurse and patient is not the only essential factor for advocating for patient safety, but also clear and regular communication between all healthcare professionals involved in the welfare of the patient. He states, "No one single professional meets all the perioperative patient needs, and this necessitates collaboration." The law also plays a large role in detailing when and how informed consent must be obtained from a patient. Joan Blanchard draws on the very meaning of informed consent, explaining in a 2010 AORN Clinical Issues Journal edition that the very meaning of informed consent is to help patients be active in clinical decisions and to protect their personal needs and preferences. This helps to understand that the clinical nurse is responsible for more than simply witnessing a signature, but also ensuring that the patient in their care is fully versed and content with the procedures and treatments that they are agreeing to. However, gaining consent from a patient is not always as simple as it might seem. There are often unique hurdles in an individual patient, such as cultural and religious requirements, or the state of the patient's mental health can make receiving consent from the patient themselves somewhat troublesome. Dana Bowen-Matthew discusses the need to close the minority gap and stop physicians' assumptions in the healthcare setting in her 2008 Race, Religion and Informed Consent Journal edition. She touches on the need for transparent communication prior to the patient awarding consent for the simple fact that every patient has different social, racial, religious and personal beliefs, and the nurses and physicians can't just know this without endeavouring to find out. For example, if a nurse had a Jehovah's Witness patient in their care, the nurse might not understand that it is against that patient's belief to receive blood during surgery should something go wrong. It is only through communication that this can be uncovered, understood, and adequately revised and documented before consent and then surgery is to occur. Through all these examples, it is clear to see that open channels of communication and the communication skills of the nurse are absolutely essential in gaining responsible informed consent. Thanks for watching.